I'm here to support the Coalition Against Gun Violence and to raise awareness about the gun violence epidemic in our country and the fact that we need to do more as a state and as a country to address gun violence. No one issue or bill is a panacea, but comprehensively we reduce the opportunities for individuals to inflict gun violence against others or themselves.
And you are?
I am Salud Carbajal, representative for the 24th Congressional District.
I am State Senator Hannah Beth Jackson.
And why are you here today?
Well, I'm here because I've been a strong supporter of what started off as the Women Against Gun Violence 24 plus years ago, and of course now it's expanded to the Coalition Against Gun Violence. And I'm here because gun violence is a major health problem in our state and in our country, resulting in unspeakable death and tragedy for families, and we've got to do something to stop it. And during my 20-plus year political career, I've worked hard to see to it that we create better gun safety laws and that we educate the public on the dangers of guns and the need to do better when it comes to gun safety.
Okay, well, thanks, Hannah.
Sure, you bet.
My name's Doss Williams. I'm a county supervisor in Santa Barbara, and I'm here today because this organization, the Coalition Against Gun Violence, has been advocating for 24 years for common sense gun legislation, and I think we are in an exciting time in the nation, even after advocacy for so long, for so many years that we thought there might be a change. I think this is the time. I think there is enough of a change in where people are nationally, enough in a change even where both the Democratic Party and even where a few Republicans are, to change the national dialogue to make common sense gun legislation like universal background checks, like red flag laws, to make that a reality.
Are people more in favor of controlling guns here in Santa Barbara County?
They are, and that's true also nationally. The shift has been really tremendous in the last 20 years.
And I'll introduce you, and then I'll tell them you're going to...
Thank you everyone for gathering to celebrate this 24th anniversary fundraiser of the Coalition in support of violence prevention and a safer community.
We'll let them talk and do kind of a free-form discussion for about half an hour or so, and then open it up to questions.
My name is Dr. Jason Prstowski. I'll go and introduce myself. I'm a local emergency physician. Like Bob, I have no disclaimers. I don't get any special interest money. Most of my jobs are volunteer. I'm the medical director for Santa Barbara City Fire Department. Do a lot of the 911 oversight in our city. I am the medical director for Doctors Without Walls, which gives free medical care to the homeless. So different discussion about access to health care. And as we discuss gun violence, it's easy to think about everything in its own little silo. Everything's interconnected. Everything is interconnected. And I also teach at UCSB. So I know Congresswoman Capps has spoken to our students about healthcare legislation, where I teach literature, philosophy, ethics, and humanitarian philosophy to pre-health, pre-med students at UCSB. And I'm going to let Sarah introduce herself, and then we'll have a conversation.
Okay, great. My name is Sarah Nimmons. I'm a pediatrician at the Sansom Clinic. We don't want to talk about patients specifically that we've taken care of in interest of their privacy, but instead, maybe in a hypothetical type of way, explain what happens after someone sustains a gunshot wound from the time that they arrive in the ER, and then following them when they don't die from their wound, what their life looks like and how doctors intersect with that. So I guess maybe since you're the ER physician, you're the first one to see them, so maybe you can talk about that a little bit.
Guns are a harm amplifier. When we think about harm, we think, well, if you're angry, you put a gun in someone's hand, that's going to cause more harm. If you're suicidal, you put a gun in someone's hand, that's going to cause more harm. Right now we're having a big debate, a discussion about mass shootings, because it's kind of the most visible as we have this debate, but as Bob talked about, it's actually kind of a smaller number when we look at gun violence, morbidity and mortality, or injury and death, as we say in public health, because when we look at those who kill themselves with a gun, those that kill their intimate partner or their domestic partner with a gun, accidental injuries, gang violence, this is going to be the bulk of what we see. I work nights in the emergency department. I was working the night of the Isla Vista shooting. If we want to bring the discussion there, we can certainly talk about it. In my career, I worked overseas with Doctors Without Borders. I've seen, a lot of my conservative friends say that a well-armed society is a polite society. I've worked in Sudan and in the Congo, and I can say that that is false. A well-armed society is not polite. There's a lot of people that are killed and injured. When there's a gun injury, and we're going to talk about injury because a lot of times with guns, it's a coroner's case, right? When, like Bob said, when someone is suicidal and they have a gun in their hand, the likelihood of suicide completion goes up astronomically. But what happens when someone's injured? And I think it's easy to talk about healthcare and healthcare costs because we're having this debate right now at the national stage, and just know that prevention of a gunshot injury is going to financially pay for itself. So all my conservative libertarian friends, I always say, hey, let's just look at the numbers. But let's kind of go through a case, as we in healthcare a lot of times like to do. And we talked about, do we come up with a fictional name for this patient? I can't remember. Fred. Okay. So nothing against anyone named Fred. So Fred is a 6-year-old child whose older brother found a loaded gun in the nightstand, and he shot Fred. Now Fred now has a gunshot wound to his abdomen. Parents are obviously very distraught, and they're very upset. Dad owns a small business. Mom has a job, and they get upset. They call 911. Our dispatchers are exceptionally well trained. They're going to answer the phone. They are now sending help. Ambulance, firefighters are on their way, and they're going to bring Fred to the emergency department. Now, when they call me in the emergency department, we're going to activate our trauma system. So at this point now, Fred is on his way to the emergency department. He's going to be here in 3 minutes. I'm now on the phone with our trauma service, so I've already called Bob at home and say, hey Bob, we have a 6-year-old, isolated gunshot wound to the abdomen. Vital signs are pretty unstable. This is someone that's pretty sick and is probably going to need a surgical operation. And the blood bank is notified, so they're bringing all the blood. Bob's OR team, they're on their way in, the anesthesiologist, they're all coming in because no matter what happens, whether or not Fred lives or dies, Fred and his family, their life is now forever changed. So Fred comes in, and he is immediately swarmed by our extraordinary emergency department staff. And we're putting in IVs, we're maybe putting him on a ventilator, we're doing an ultrasound. All the while, we've now called in our case managers and our chaplains because Fred's parents are there. And in the pediatric literature, we believe that parents should be present during resuscitation, that a child should not be alone. So Fred's parents are both in the corner of our trauma bay, while a social worker is talking to them saying, okay, what's happening now? You can see that they're giving a blood transfusion. You can see this is the attending surgeon who's coming in. He's making a phone call to his team, kind of dictating what kind of surgical procedure. Mom and dad are upset. They're traumatized. They're wide-eyed. Mom is in tears. Dad doesn't even know how to react, and he's just standing in silence with a blank stare in his face. And at this point, I think we've determined that Fred has a gunshot wound. He's injured his intestines. He's injured a lot of his internal organs. So Bob and his team is going to take Fred to the operating room.
I'm Bob Kennard. I'm a pediatric surgeon at Cottage Children's Medical Center. The child who was the same age as one of my daughters, who found her father's gun and shot herself. It's unclear. She shot herself or her father shot her. But the walk from the ER to the conference room at the end of the hall, and it's every ER is the same. It's always this long hallway to the conference room that the family's waiting. And
they're scared. One thing about kids is that they have tremendous dignity, and so they know if they cry that then their parents will start crying. So they put on a brave face, and they're typically pretty stoic about it. And the parents are just in shock. They're watching this all unfold to their child who, 30 minutes ago, it was just another normal night. They're going to bed, until this happened. So they're in the ER for you're going through all this for probably 15 minutes or so. We're lucky in Santa Barbara. Cottage has a level 1 trauma center, so there's always a trauma team available. There's always an OR open and ready, always an anesthesiologist. And so we take the patient expeditiously off to the OR. I always touch base with the family before I actually go, and it doesn't matter what hospital, of all the hospitals I've worked in over the last 20 years, there's always seemingly this partially lit hallway. I'm sure it's very bright, but to me it's always partially lit. And there's a small, really nondescript room with some sort of hotel-type art on the wall and a couple vinyl chairs in there. And that's where I tell them that your child is severely injured. They, as you know, they've been shot, and I don't know if they're going to survive. And so that's kind of the first, and that's usually the last thing they hear, where just all the emotions break out, and usually family falls apart. And so the chaplain is there, the social worker is there. They're not going to hear much more than I say. So I go to the OR, and it is astounding how much blood a 6-year-old can have in their little body. But we keep giving blood and keep giving blood. I let the sometimes can only get the bleeding to stop and slow down in the OR, and so we'll just leave them open and say, you know what, let's get through tonight. Let's get them warm again. Let's get their little heart working better, and we'll come back tomorrow. Let's survive tonight, and we'll fight another day. And there is, the cleanup is usually monumental from that. There's many socks I've just had to kind of throw away rather than take them home. So then they're in the hospital, usually for about 2 weeks, maybe in the ICU. If Fred survives and we get him put back together, we can eventually get him home with home nursing or to to some sort of pediatric rehab center. It depends on what the injuries are, kind of what happens next. So if they have lost a significant amount of intestine, then they're getting their IV nutrition managed. If they have a spinal cord injury, then there's a lot of other rehab issues and a very high mortality. But I'll let Sarah talk a little bit about the outpatient side.
And I think Dr. Kennard in some ways downplayed how serious those surgeries can be. I mean, when you're shot in the abdomen, you typically have a significant amount of blood in your abdominal cavity, and that's not something they're going in and fixing laparoscopically. They're opening you across your whole abdomen, and they're just packing you full of gauze to try to find what's bleeding. And so, speaking to some patients that I've cared for in the past when I was working in hospital medicine, when you lose that much blood, unfortunately your intestines need blood to survive, and so it's not uncommon to lose pieces of your intestine, and in some severe situations you can lose so much of your intestine that you'll never be able to digest food again, and they may not be able to put you together in an anatomical way. It may mean that they have to create something called an ostomy, where instead of being able to stool the way that you anatomically would, instead you have a bag that catches your feces. And so typically when someone's as sick as our hypothetical patient Fred, they're put into the ICU where they have an ICU doctor that's a specially trained pediatrician take care of them. And there's a lot of different things to manage, from nutrition to making sure their blood pressure and heart rate's okay, making sure that they are comfortable from a pain standpoint, and also avoiding infection because something foreign has been introduced into the body. And so there's also a huge social piece to this, because Fred's brother, who may have thought it was a toy or didn't realize it was loaded, has now done something that can never be taken back and that he'll probably feel guilty for the rest of his life. And so working on that piece, making sure that social services doesn't need to be involved, like this truly was an accident, and also thinking about how those parents are going to be psychologically changed, but also maybe not be able to return to work. So that's another piece that a pediatrician helps with. And then when you're in the hospital for a significant amount of time, not moving, not getting up and walking, unfortunately your muscles atrophy and you become very weak. And so we get physical therapists, occupational therapists involved, and if it's a brain injury, I mean other types of therapy as well, because you may need a wheelchair for the rest of your life. So then after you're discharged from the hospital, you're going to have a lot of follow-up. Like in a hypothetical patient that isn't going to be able to use their intestines anymore, they're going to have a GI specialist that manages their IV nutrition, which means for the rest of their life, 24 hours a day, or maybe you can cut it to 20, they're going to be hooked up to an IV bag that they have to carry around in a backpack to get the nutrition they need to grow. And so there's going to be follow-up with that person. There's going to be follow-up with the surgeon until everything is stable and fixed. And then also, you know, your pediatrician, who not only does your normal care, like making sure your vaccines are up to date and that you're thriving in school, but also helping to coordinate all those specialists. So since we've lived through these horrible scenarios, you can see why we would feel so passionate about preventing gun violence, especially accidental injuries. And one piece that Dr. Kennard talked about in his lecture was safe storage, and just piggybacking on that, not only holding the adult that owned the gun accountable for what happened, but also just making sure that there's a law about how the gun is supposed to be stored, like locked in a safe, unloaded, separate from the ammunition, with even like a trigger lock on it, which would prevent a kid from being able to pick it up and shoot somebody.
Well, I think one of the important pieces of this, since we're talking about Fred, is that an hour before this happened, Fred was a young, healthy 6-year-old first grader. Now Fred has a debilitating injury and illness and is going to be accessing health care for the rest of his life. And we haven't even begun to scratch the surface of the psychological trauma that Fred's going to go through. You know, if the Hulk is your hero, Hawkeye Pierce is mine. And Hawkeye Pierce from MASH used to always say, I'm a surgeon, I don't take care of sick people, I take care of healthy people whose bodies have been invaded by bullets. And now we have someone who was previously healthy who is going to have complications from their ostomy, complications from their medications, is going to be in my emergency department probably every other week. Yeah, is going to miss days of school, is going to learn arithmetic in the hospital, counting drips. And I think it's important as we tell these stories, because is to keep bringing up the science that the case of Fred is far more common than the good guy with the gun, where that loaded gun in the nightstand protected them from a hooded invader. That is the rare story that gets highlighted all the time in the media. The common is those that die from gun violence and those that are injured by gun violence. And when we talk about the data, it's important, and I know some of our health policy makers are still here in the audience, that I speak on behalf of so many healthcare providers. Like, please, let's control the variables that we can. And a lot of these laws that Hannah-Beth and Doss and Salud and so many others, and Lois have put before the state and federal legislation, I mean, increasing access to healthcare is a whole other issue. Increasing access to mental health, a whole other issue. Trying to decrease the amount of trauma that our children are exposed to, another issue, all interconnected. But guns are the public health harm amplifier. And making reasonable gun control legislation to just make it a little bit more difficult and a little bit less common. Because right now, Fred, this is a catastrophic event for his family. You know, Dad may or may not have gone back to work. Mom now has depression, may have attempted suicide. Fred's brother has a lifetime of mental illness because of this experience. And now that Dad's lost his job, they don't have health care. So now we have all this psychological trauma with no access to health care, right? That some of the low-hanging fruit is there. Making it harder for the wrong people to get guns, educating people about good gun stewardship. For all my friends who are law-abiding citizens, and I always tell this story, my wife and I have a 2-year-old at home, so a lot of this is really hits home to me because my 2-year-old, they had a lockdown drill in his daycare for what to do with an active shooter, and that's normal. But we recently went to visit my brother-in-law in Idaho, and we have very fired debates about gun ownership. He is one of those 1%. He's got a whole arsenal in his home. And I said, Gary, we're coming to visit. I have a 2-year-old. He likes to put his hands in drawers and pull things out and put them in their mouth. He's 2. I need your word that all of your guns will be unloaded and locked. And if you can't give me your word, then we're not coming to visit. And he said to me, and this is the first time, because I was all geared up for a debate. I'm like, here we go again. You know, I'm not a constitutional scholar, but here we go again. He said, you know what? That sounds reasonable. And as someone who spent a career in Civil War overseas, seeing what military-grade assault weapons do, and they're designed to go tearing through the tissue and kill people. That's what they're designed to do. As someone who used to do volunteer work in inner-city Chicago and inner-city Atlanta and saw the revolving door of all of these 12-year-olds with wheelchairs in their ostomy bags because they'd been shot, all of a sudden I'm having this debate for the first time. I'm hearing someone say that's reasonable. And I think as we have this debate, while we're talking about suicide, intimate partner violence, accidental injury, mass shootings, I mean, the fact that after Connecticut, we still have people that say it is my constitutional right to have an assault weapon is from someone who has been accused of this, you know, stay in your lane, doctor, as someone who's seen what these things can do, is astronomical. Because Fred is a catastrophic tragedy to his family. That's a Tuesday for us. I mean, we've looked at the statistics, and that's normal. So I don't know if there's anything you want to add, Sarah, at all, or Bob. Yeah, probably open up for questions.
Are there any questions, anybody? Yeah, why don't we go ahead, why don't you just go ahead and ask.
Can you speak to incidents of domestic violence or attempted suicide? Another way that we need to address it.
Let me take a stab at this. And so suicide, I don't know if is Joyce still here. With suicide, the likelihood of completion of suicide with a gun is so high, they tend to not make it to the emergency department. Like, I'll get a phone call from the paramedic, we call it base station contact. Hey, Cottage Base, this is Medic 23. We're here on scene with an isolated gunshot wound to the head, suicide attempt. There's a note. We have fixed pupils, no pulse, permission to pronounce on scene. Permission granted, time of death. And then I go back to work. So, and then, like, you may be sitting in the waiting room, just know if I see you and you've been waiting 30 minutes for your ankle sprain, know that I just had this phone call. So, I mean, in some ways, you know, we see the botched suicide, which happens from time to time, but it doesn't happen as often with guns. Intimate partner violence, you know, like, the statistics are very clear. I've showed the numbers. People are far more likely to be shot by someone they know. That's the reality. And a lot of times there's alcohol and substance abuse. A lot of times when people knew that family, they say, wow, I'm not that surprised. Sometimes there's been social media postings about it. And, you know, the physical you know, we always say that trauma surgery is anatomy and physics, right? You take a piece of metal and you put it outside of the muzzle of a gun at 1/2 times the ballistic mass of the bullet, velocity squared. You fire it out of that thing at how many, 5,000 meters per second? And then it goes tearing through the skin, bone, lung, aorta, maybe nicks the liver and then comes out the other side. That's trauma. But a lot of as we talk about society, and where a lot of, you know, the policymakers like Hannah Beth and Lois can attest to, and you too, Kathy, is a lot of this is kind of, we see it coming, but we can't do anything about it, and that's why these red flag laws are so important.
So for an annual physical exam, especially for children that are mobile, I'll ask if there's a gun in the home. It's one of my standard questions, just like, what is your child eating? How are they sleeping? Are they able to stay dry through the night? Then I say, is there a gun in the home? And I worked in Texas and Arizona as a physician, and in Santa Barbara, I hardly hear a yes. And when I do hear a yes, it's usually like, yes, but their dad is a, you know, law enforcement agent. But when people do have a gun in the home, I do tell them cautious tales. I tell them that most people have a gun to protect themselves, but unfortunately it puts your teenager at risk, because teenagers are curious about guns and they want to show their friends because they think it's cool, and they can accidentally shoot themselves. And it's been proven that even if you educate the child about gun safety, that doesn't protect them. What protects them is making sure it's stored properly. And then I also talk about how impulsive teenagers are, because the part of our brain that controls higher level decision making, our frontal cortex, isn't fully developed until we're about 26. So like Dr. Kennard said, the average teenager thinks about committing suicide for about 10 minutes before they actually do it. So if there's a gun in the home and they have this impulse, they're way more likely to complete than they are if they go and take a bottle of Benadryl. Like, yeah, they're going to be sick if they take Benadryl, but most likely after a night in the ICU, they're going to be normal again. So I do talk about it. And, you know, it's a hot topic because at one point in Florida, they were asking physicians not to talk about it, that they felt we were staying out of their lane, that, you know, we were getting out of our lane and doing something inappropriate, but I think it's absolutely appropriate. So I'm glad that we're allowed to talk about that here. Yay.
I think it's also, it's a bit of a balance. I mean, you know, when you see a patient and you don't want to create an adversarial relationship, you know, especially when I'm asking parents for the permission to take their child away from them, put them to sleep, and cut on them for an elective operation. And so it's always, it's you know, kind of feeling that out, and it really depends on the family, you know, how you can broach that subject.
But it has been shown with smoking and seatbelts and all that, that if a physician says it, you know, a patient or parents are much more likely to at least think about it and act on it.
Totally, totally, and that's where I think.
Because I don't know if everybody repeat her observation.
That it's been shown in multiple studies that if a physician says don't smoke or cut down your drinking or any sort of public health thing, people are much more likely to listen to that and take that advice and act on it than if it's, you know, a PSA in the middle of the night.
I just want to make one comment, is that, again, gun violence falls into the public health paradigm. A lot of people are trying to keep it out of the public health paradigm and say this is a legal, constitutional discussion, this is a criminal justice discussion. Like, smoking causes lung cancer. If you take cigarettes away from children and make it harder for them to get cigarettes, then you have less lung cancer, right? Helmets, when you ride your bicycle, protect from brain injury. And when you say, ride your bicycle with a helmet, then you're less likely to get a brain injury. Gun violence, if you have a gun in the home, your likelihood of suicide, intimate partner violence, accidentally shooting your adolescent child when they wander home at 2 in the morning from the party goes up astronomically, but we're not allowed to talk about it as a public health issue. And just to say that gun violence is a public health issue and it needs to be talked about within that paradigm, because when you do good evidence-supported interventions early on, then you prevent catastrophic outcomes. And that's what the science points to. And granted, we need better science. So, but it's important to always keep that in mind.
Give a round of applause. These are the folks in the front lines. Yes, it's a health issue. So this is a resolution on behalf of the state of California to thank you, Tony Wellen, for the extraordinary work you've done. Wishing you well in your next iterations, the next battles. I suspect I know what some of them are going to be. But everyone, if we could give another round of applause to Tony Wellen and your 24 years with the coalition.
Thank you, doctors, for bringing an issue to our audience and to the public, which I am going to continue to discuss in the newspapers and wherever I speak. That 6-year-old boy, he has a lifetime, and his family has a lifetime. And this is happening with thousands of children every day across the country. So we need to focus on that and try to reduce this kind of injury and reduce gun violence. We don't want to put you out of work.
I would be happy if you put me out of work.
Okay, I'm Jack Friedlander, retired Executive Vice President at Santa Barbara City College. My thoughts are that the work that the Coalition Against Gun Violence is doing is extremely important, that guns take away our freedom of movement on the streets. The human toll, financial toll of guns and gun violence is astronomical, and I'm glad that there's an organization in Santa Barbara that's trying to address this plague, which is really a mental health, physical health, and physical drain on our society.
Thanks a lot.
Sure.
My name is Jeff Green, and I've been coming to the Coalition Against Gun Violence events for at least a decade and a half. I think it's been the most consistent organizing force we've had locally against gun violence in our community, for certain.
And where do you work?
My day job, I'm the CEO of the foundation at Santa Barbara City College.
Do you have issues to do with gun violence?
Well, I think we all do, and of course there have been a number of issues that in this community, Santa Barbara City College covers so many parts of the community. There are generations of people that have been part of it, from faculty, staff, generations of students that have gone there, and many of those families have been touched by gun violence, whether they be high-profile incidents, as we've certainly seen, or more private ones within families.
Okay, well, thanks for your thoughts, Jeff.
Thank you.
And you are?
Do you want to step away from the music, or are you good?
No, I'm good.
Okay. District Attorney Joyce Dudley, and I've been a long-time supporter of this coalition. I'm also a founding member of Prosecutors Against Gun Violence, and it's eminently clear to me that gun violence is the #1 health hazard in America, and that we have to do all we can, in a matter of public safety, in a matter of health, to stop it.
Now, if people haven't had a loved one or someone they know shot, they're still affected by this, aren't they? And how so?
Because people are always afraid. There was a time when people could go to a festival. Worse, there was a time when children and parents, grandparents would send their children to school and feel they were going to be safe. No one feels that anymore. No one feels completely safe when their children go to school. And so it affects everybody, even if you haven't been injured by it. And the other piece is toddlers killing other toddlers. We now have about 1 toddler a week being killed in America by another toddler or killing themselves because guns aren't safely stored. So I feel very strongly about both these issues.
Thanks for your thought.
Thank you.
Hi, I'm Gail Marshall, and I'm from Carpinteria. I'm here to support the Coalition Against Gun Violence, which I have done for 15 or 20 years because we've always needed the group. We need it more than ever now. It's important to understand how terrifying it must be for children to have to undergo drills because somebody might be out to get them. And the coalition has been around doing the good work for years. They'll be around for many more years, and their work could not be more important.
Have you been involved in any gun legislation?
Yes, as a matter of fact, I voted with my colleagues on the House floor and passed universal background checks recently. And I also initiated my own bill called the Extreme Risk Protection Order Act, which would allow family members and law enforcement an opportunity when they come across a family member who's exhibiting behavior and signs that they are a danger to themselves or others, to be able to petition the courts and to be able to temporarily take guns away from individuals who find themselves in that crisis.
Okay, well, thanks, Lou. Keep up the good work.
Thank you. Glad to be here with many people who think alike and believe there's a lot of room to be able to move forward gun safety legislation.
I'm Jason Dominguez. I'm a city council member for the city of Santa Barbara. I represent District 1 in the city, and I'm here because this is such an important issue that we get guns out of the hands of people who have mental health issues, criminal backgrounds, and help protect our residents.
And have you had any experience with gun violence, or does the city?
I have experience because I was a criminal prosecutor for the city and county of Los Angeles and also for the United Nations. I was a war crimes prosecutor. And so I saw firsthand when I was interviewing victims and witnesses the damage that guns could do to communities. I grew up in the east side of Los Angeles in Maywood, and there were a tremendous gang problem, and it really interferes with all aspects of life, even if you're not directly a victim.
And so if you get guns off the street, that would help with gang violence?
Oh, absolutely. Guns are one of the leading causes, obviously, of death, and I think it's part of the macho culture and part of, you know, what leads to people being stigmatized.
Well, thank you, Jason.
I'm Oscar Gutierrez. I'm the Santa Barbara City Council representative for the West Side, the 3rd District. And I'm here because I got to know the Coalition Against Gun Violence because I work for TV Santa Barbara, and they came in to produce a show, and I was the director and editor. And I just love their message about just trying to reduce gun violence and keep people and family and children safe. I was on campus in 2014 when they experienced their shooting in Isla Vista, and it really brought it home to me about how dangerous it is to have weapons in the wrong hands. So I'm pretty passionate about this organization and what they do.
What neighborhood do you live in, and are there any gun problems there?
I live on the West Side, and there have been instances in the past where guns were used for violence, and I know that it's something where, you know, if there was more education by organizations like the Coalition Against Gun Violence, I strongly believe that there'd be less acts of violence with these weapons.
Well, thank you, Oscar. Keep up the good work.
Thank you.
I'm Kathy Murillo. I'm the mayor of Santa Barbara, and I'm here to, as I always do, support the Coalition Against Gun Violence. Our youth council, which is a teen advisory council to the Santa Barbara City Council, is very active with the coalition. They're a coalition partner, and they were outraged after the shooting in Florida, where all the high school students rose up, and they're part of that movement. So I'm here to encourage our youth to take action in this important issue.
Even in a destination city like Santa Barbara, we have a problem with guns, don't we? Or do we?
I'm remembering the 2006 postal shooting in Goleta. I knew people who were killed. It devastated our community, and so we have had extreme gun violence here with loss of life. It's time for us to take action and stop gun violence.
Well, hi, and you are?
I'm Julia Miner, Vice Chair of the Santa Barbara Youth Council.
And have you done anything with gun violence?
Yes, so as Santa Barbara Youth Council, we made a PSA, a public service announcement about gun safety, and do you want to explain?
Yes, and we just thought, since it's such a big issue that we've noticed, especially in the local schools and around the country, we really wanted to do something to address that, and so we created this public service announcement that involves gun violence and gun safety in order to address the issue.
Thank you. Anything else you want to say?
Yes, and after the Parkland shooting in Florida, we invited the mother of one of the students at the school in Parkland to come speak on a panel about gun safety at our Teen Leadership Conference. And so we've really been trying to make the community more aware and talk about this issue that is prevalent throughout the country.
I'm encouraging our youth council to work with the coalition on a program, an educational program, encouraging families to store their guns safely. So if your child is going to go visit a friend, how do you approach the mom over there and say, hey, if there's any weapons in the house, can you assure me that they're stored safely? It's common sense and something that helps everyone.
Excellent. Thank you, Kathy.
Yeah, Marty Bloom, former mayor, and I'm here because I really support this group. It's been an amazing thing that they've done over the number of years, reducing the number of arms in our, by having the buybacks, and just making everybody aware of the terrible carnage in our country. It's a terrible place to feel safe. It's hard.
When you were on the council, did you do something to do with gun violence?
We did. We did a junk gun restriction for the city. And we also did a...
What was that?
There were these little guns that were real cheap. That's why they call them junk guns. And we just said... We said you're not allowed to sell them in the city because we couldn't do anything else, and there's only 1 or 2 gun shops in the city. But the truth is, it was a statement, so people realized that there were junk guns and what they were. So, you try to do what you can do.
That's why what? Well, thank you, Marty.
Thank you.
I think this is a wonderful event. We, Dr. Nimmons, myself, and Dr. Prasowski started this conversation probably about 6 months ago through an event that Tony arranged, and at the end of the hour of speaking, we said, wait, there's more we need to talk about. And so she said, let's do it now. And so it was great to get back together and continue our conversation about kind of the medical side and all the sequelae of the gun violence epidemic that we have.
Well, thank you.
Sure. Thank you.
Thank you.